Welcome to Homes on Health, the podcast where nutrition, fitness, and hormones meet health span and science meets real life. I'm Dr. Alan Holmes, a recovering emergency physician turned expert in hormone optimization, metabolic wellness, and living life fully optimized. Each week, we dive into the tools, truths, and evidence-based therapies that help you build a stronger body, sharper mind, and more vibrant life. Whether you're curious, confused, or already optimizing, you're in the right place. Thank you for being here. Let's get into today's episode. Hello, and welcome back to Homes on Health, the podcast where we cut through the noise of wellness trends and we talk about what really moves the needle for your health, vitality, and longevity. I'm Dr. Alan Holmes, and today we're going to talk about what I like to call the happy hormone, progesterone. So whether you're in your 20s and 30s suffering from PCOS, or maybe you're in your 40s navigating through perimenopause, or maybe you're already in your 50s, menopausal, postmenopausal, this story is for you because micronized progesterone can play a huge role in how you feel physically, mentally, and emotionally. So let's start with the basics. What is progesterone? It's a hormone that's produced mainly by the ovaries. And to be specific, it is produced by what's called the corpus luteum, which is a temporary gland that is formed after ovulation. Now, this is going to become important in a bit when we talk about PCOS and the potential for not having ovulation and therefore leading to no corpus luteum being created and therefore no progesterone being created. Progesterone, well, it does a lot of things. It balances the effects of estrogen. It supports mood. It protects brain function and prepares the uterus for pregnancy. But once ovulation becomes irregular, whether that's because of PCOS or perimenopause or later with menopause when there is no ovulation, progesterone levels drop. And that leads to a lot of just very classic symptoms. This can include anxiety, irritability, or even mood swings. It can lead to poor sleep, hot flashes, night sweats, as well as irregular bleeding or worsening PMS symptoms. So the other thing to think about is that with lack of progesterone over time, this can actually increase your risk for breast cancer. That's important as well for obvious reasons. So micronized progesterone is bioidentical. And what do we mean by that? We've said that before in this podcast. What does bioidentical mean? It means it's chemically identical to what your body naturally produces. Where does it come from? Well, it's derived from plant sterols, such as from wild yams. And then that gets converted in a lab to true human progesterone, meaning progesterone molecules that look isomolecular or identical to the progesterone molecules that your body makes. Now, this is very, very different from synthetic progesterones, like medroxyprogesterone acetate. This is the molecule found in the medication called Provera, or in the Premarin plus Provera medication called Prempro of decades ago. So we're going to talk about the differences in a minute, because one of the biggest sources of confusion in women's health is this idea of progesterone and confusing progestins from micronized progesterone. So let's just break this down by phase of life. And so we'll start in the early 20s and 30s when we'll discuss women that may have PCOS, and then we will progress from there. So in PCOS, women often don't ovulate regularly. Therefore, that means less production of natural progesterone because no ovulation, no corpus luteum gland forms, and that is what creates the progesterone. So what does this do? Lack of progesterone can lead to heavier cycles, mood swings, and even trouble sleeping. So cyclic or even continuous use of micronized progesterone can help regulate your cycles. It can decrease anxiety and overall PMS symptoms. It can protect the uterus or the uterine lining from overgrowth, and it can support better sleep quality. Studies have shown that progesterone can even improve GABA receptor activity in the brain. Why is this important? Well, it leads to a calming effect because the same calming neurotransmitter is targeted by anti-anxiety medications like Xanax. Well, micronized progesterone can have this same effect naturally. So let's move on to perimenopause. How does micronized progesterone play a role in perimenopause? So this is when cycles become irregular. Estrogen levels can swing quite high, progesterone levels drop. This imbalance leads to mood swings, night sweats, poor sleep. Micronized progesterone has been shown in perimenopausal
women to reduce hot flashes and night sweats, improve sleep quality, as well as, again, reduce anxiety and irritability. There was a study by Hitchcock and Pryor in 2012. It was published in Menopause that showed that oral micronized progesterone improved night sweats and sleep quality in perimenopausal women. That's just one example of many, many similar studies that is in the literature about the benefits of micronized progesterone in perimenopause. So let's move on for a minute to menopause. So once ovulation stops completely, this is the definition of menopause, progesterone levels fall to essentially zero. Even in women who are on progesterone therapy, adding in progesterone is absolutely critical, meaning no woman in menopause should be on estrogen without progesterone if they have a uterus. And I would even argue that even if they have had a hysterectomy and no longer have a uterus, they should most definitely be on micronized progesterone. So what does the progesterone do? Well, in part, it protects the uterus from overstimulation or potential overgrowth of tissue lining due to unopposed estrogen. But what else does it do? It also has a positive effect on sleep, mood, bone, and brain. There was a study in Climacteric in 2018 that showed that progesterone therapy was both safe and effective, as well as it improved vasomotor symptoms such as hot flashes and night sweats, as well as sleep without, and here's a really important part, without increasing the risk of breast cancer. So let's talk a bit more about progesterone versus progestin. And this is a really, really important part of the study. We've mentioned it multiple times on this podcast, and I'm going to keep mentioning it because it just remains confusing. The infamous World Women's Health Initiative study back in the early 2000s, that study used synthetic progestins, specifically medroxyprogesterone acetate. It did not use bioidentical progesterone, which we're talking about here today. That's the version that was linked to increased risk of breast cancer, heart disease, and blood clots. But when we look at studies using micronized progesterone, the risk profile is completely different. And in fact, it's shown to be protective. The E3N French cohort study, 2008, it showed women using bioidentical estrogen and micronized progesterone had no increased risk of breast cancer compared to non-users. This is unlike all the studies using synthetic progestins. There was a meta-analysis that was released in Climacteric magazine in 2022. This confirmed that micronized progesterone is not associated with increased breast cancer risk and may actually have protective effects on breast tissue because it is apoptotic, meaning it kills breast cancer cells. So when we talk about safety, the distinction between bioidentical progesterone and synthetic progesterones cannot be overstated. This isn't just terminology. This isn't just semantics. This is what the evidence-based medicine shows. So what are the other benefits of progesterone? We've said that it makes cycles better. We've said that it affects mood in a positive way. What else will it do? Progesterone binds to receptors in the brain that promote calm, relaxation, and better sleep. Many women that are on micronized progesterone claim best sleep of their life. In part, it does this by increasing the activity of GABA. This is your brain's main inhibitory neurotransmitter. So this quiets the brain. It quiets the mental chatter that many women experience, particularly at night. That's why many call it the happy hormone. It helps you fall asleep faster. It helps you stay asleep longer and also wake up calmer and just in general more balanced. So as we conclude, if you've been told that progesterone is just for fertility, that's incorrect. If you've been told that it's dangerous because of the old studies of the Women's Health Initiative that we have mentioned multiple times, I'm hoping that this episode again kind of clears that up for you and helps you understand the distinction between the synthetic and the natural micronized bioidentical progesterone. Micronized progesterone is one of the most powerful, natural, and protective tools we have in women's health today, whether it's PCOS or perimenopause or menopause.
Thank you for tuning into this episode of Homes on Health. If you found today's episode valuable, share it with someone you care about. And hit subscribe so you never miss a future episode. Want to get more of our content? Follow me on Instagram and YouTube at Alan J. Holmes MD. Until next time, here's to living life optimized. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.